As most of you know, ChiroSecure doesn't just fund our own research, but rather we fund as many research projects as we can that have the potential to finally document not only the efficacy of chiropractic for musculoskeletal pain, but also research that is more likely to show the value of removing subluxations and its effect on longevity and human performance. So today's show is to make you aware of the research that is actually going on in chiropractic, and more importantly, how to take all of that research and use it in your daily practice with your patients and potential patients. Because one of the things that I find as I go around the country and talk to doctors and talk to them from the platform one-on-one, it seems that so many chiropractors aren't aware of all the research that actually is in the chiropractic profession, even though we're told over and over that there's just nothing to substantiate what we do. So today, we're going to address, what is evidence-based practice? Also, the importance of an evidence-based practice and barriers to that evidence-based practice. I'm going to let our guest today, who I am so excited to have on here, Dr. Dean Smith, who has been a ChiroSecure client for as long as I can remember, and we really appreciate him on so many levels. But he's going to talk about all of the research you need to know about for your evidence-based practice. So, Dr. Dean, I want to introduce you and welcome you to ChiroSecure and our show, and have you start off with a little presentation about the research projects. And we want, to see what we can do to incorporate this information into our viewers' practice.
Okay, very good, Dr. Hoffman. I really appreciate the kind introduction. I will go ahead and start the PowerPoint presentation here. Okay, so as Dr. Hoffman said, my name is Dean Smith. I am a chiropractor, and I went back to school to get a master's degree and a PhD so that I could understand how research works and then apply it to chiropractic. So I run a podcast, and it's called chiropracticscience.com. It's available on iTunes. And what we do is we allow the chiropractic scientists to actually tell us what their research is all about. So over this presentation, I'll give you a little bit of information about what an evidence-based practice is, as Dr. Hoffman said, what the barriers are, and what kinds of things we talk about on the podcast. So just a little bit about myself. As I said, I'm a chiropractor. I've got a master's degree in exercise science, a PhD in brain and cognitive science, and my main research interests are to investigate the effect of chiropractic on human performance. So I look at things such as gait, postural control, muscular strength, and the like, mostly motor control type of data. I've published many scientific articles and conference publications. I'm a full-time clinical faculty member at Miami University in Ohio. I still have a private practice with my wife, who is also a chiropractor. So I'm in the office about 1 to 2 hours each day, just enough to keep my hands busy and active in chiropractic practice. And I'm also the founder of chiropracticscience.com. So as an overview, I hear questions all the time of what exactly is evidence-based practice. And there are definitions for these, and one of the common ones is that evidence-based practice incorporates the best research evidence with individual clinical expertise and patient choice or values. One thing I want to poke on a little bit before we get into the rest of the presentation is that a lot of people lately, it seems to me, really hone in on the research evidence. And as a researcher, I like that, but we can't forget that we need to incorporate clinical expertise and patient values as well into this evidence-based practice. There are many conditions, whether it be viewing from a chiropractic perspective or a medical doctor perspective, where we just don't have great evidence. And so we need to rely on our clinical expertise and the values and choices of our patients. So that's all considered part of evidence-based practice. So why is this so important? Well, patients, payers, and chiropractors as well want care that's effective. Patients want to be safe, safe as possible, and we want our care to be efficient as well. So what are the barriers to evidence-based practice? Well, there are many, and there have been a few studies that have actually surveyed chiropractors and found that lack of research relevance, so in other words, the study findings didn't seem to be relevant to the chiropractors in practice, a lack of time to try to implement evidence-based skills, and then simply insufficient skills for looking at and appraising the research that's already out there. As Dr. Hoffman said, there's a lot of excellent science out there already, and when I talk to chiropractors, that's one of the things that I get is they try to compare us to other fields, for example, medicine when it deals with the spine in particular, and somehow they think that medicine has more evidence than we do, and perhaps in some things they do, but I'm trying to get the word out that we have a lot of excellent research, and this is simply one way that I have developed or adopted to try to get this word out. So what is the purpose of chiropractic science, this business that basically I've created, is to get that chiropractic evidence out there, and we do it with convenience. So we run a podcast, so we have chiropractic experts, the actual investigators, the chiropractic scientists that are doing the research, come on the podcast to tell us in their own words what the study means to chiropractors. And I think you'll find if you have a listen to it that it's a really good resource, and it's incredibly motivating, and I think a confidence generator for chiropractors in practice to listen to people at the top of their field in not only chiropractic but also in research who really know their stuff and who are just giving us the basics on what their research means and how you can apply it to practice. So the format is...
Dean, can I just add to that?
Absolutely.
I think that those types of programs, those podcasts, are so important for our doctors to participate in, and I really support what you're doing with that, because there are different ways, and I know we're going to talk about this a little bit later on, but there are different ways to actually incorporate and be empowered through the research that already exists. And one of the things that we strive to educate the doctors about, like even when we were talking about the stroke issues, is the more evidence-based information you have and you own, and we give all of the research summaries out with our informed consent to our doctors so that they can study it, own it, so that when they're discussing any of this with a patient or prospective patient, they are empowered and they're not being defensive but educational. And having a podcast like that offers up the opportunity for the doctors to be educated and to start to know and be familiar and own what's out there, I just want to say that I think it's essential. So thank you, and just wanted to add that.
Thank you. Well, I really appreciate those comments. And one of the things that I've done with the podcast is I actually send links to my patients to listen to some of the podcasts, especially if, for example, they have questions about, well, how does a chiropractic adjustment work? How could it possibly relate to this condition or that condition? And now what I've been doing is just say, well, why don't you listen to my podcast where I interview this person? And so I found that a good way not only to educate the doctors, but also to educate your patients and presumably other healthcare practitioners in your community. You could send this. So I'm just trying to do my part, Dr. Hoffman, and get this information out there. I realize there's lots of different ways to do that, but it's simply one way that I can help. We also,
with the research, we here at ChiroSecure have always been involved and supportive of chiropractic research, and I'm not going to go on and on about the research we've done or support or anything else. You're another person out there that's absolutely interested in getting this to the doctors, and whatever it takes, we're supporting, because I just want the doctors to understand as loud and clear as I could make it how important it is because you just brought up another thing that I don't want to be overlooked. You know, when I talked to a medical doctor just recently, he was talking about statins. And, you know, he has a very different perspective on it than I do. And he's simply telling me that in a room of over 500 internists, when asked how many of the internists are not on a statin for their cholesterol, 5 hands went up. And he thinks that's saying how safe statins are because these people all bought into it, whether the science is there or not. And what I'm trying to say is that my perspective is totally different. They drank the Kool-Aid. If that many internists think that we're lacking statins, that everyone on the planet needs to take them, something's wrong with that. And when we know that what we do as chiropractors is so powerful, we need to get that information out in a way not only that the patients understand, but other doctors and attorneys and all of the different professionals in your community can understand and get and have access to. And you said that. I just wanted to elaborate on that based on a recent experience I had for myself.
Great, and we all have these experiences for sure, whether it's a medical doctor or other practitioner or even patient in the community. So absolutely, we need to get the information out. And you know, I started this actually because one of my own papers that was published in 2006 had talked about how chiropractic on it was a small study, how chiropractic could affect movement time. And I had read on other chiropractors' websites a year or 2 years after it was published about how chiropractic affects reaction time. So it's two different concepts. They're similar, related, but they're not the same. And so then it just kind of opened my eyes to, wow, if people are misinterpreting or misquoting what I've done, I'm sure they're misinterpreting or misquoting what other people have done. And so then I thought, well, why don't I just get it from the horse's mouth, so to speak, and we'll actually talk to the actual researchers that are doing this. So on chiropracticscience.com, you can find research summaries. So we'll take an article and we'll basically dissect it into its various parts, and then we'll come up with some key points. So you're welcome to do that, to look at chiropractic science as well. I publish Facebook posts as well, so you can go onto our Facebook site and check out all those posts, and please share those. I'm not making any money from doing this. I'm doing it out of passion. So please share.
How do they find it on Facebook?
It's if you type in chiropractic science in Facebook, you'll find it. I'm not sure what the exact link is.
Perfect.
But they'll find it for sure. So what I'd like to do now is take you through a tour of just some of the podcasts that I've done so far. Most of the chiropractors are chiropractors plus PhDs, and a couple are pursuing the PhD at the moment. So every single one of them actually is higher graduate education in addition to a chiropractic degree. So I just wanted to point that out. So one of the first, their very first interview that I did was on Z-joint gapping. So this was with Dr. Kramer, who is at National College, and what he's done is a series of MRI studies looking at how when we put people in a side posture position or we adjust them, that there's an actual gapping of the zygapophyseal joint. And that gapping has been related to a reduction in pain and better mechanics of the lumbar spine. And that's even improved from just putting people in the side posture position. So there's something important about the adjustment, and it seems to be bearing out in MRI studies. So a practice point that I thought of when I considered that was, okay, yeah, so the adjustment works well in terms of gapping a joint. It may help to break up adhesions, which is one of the hypotheses that can negatively impact the spine. And in addition to adjusting them in side posture position, perhaps what I took away from this was we could hold the adjustment for 5 or 10 seconds after and also get the benefit of just that side posture positioning, gapping the joint a little bit more. The next podcast, or one of the next ones I did, was on pediatric chiropractic, and that was done with Dr. Katie Pullman, who is currently pursuing a PhD at the University of Alberta, and she is running a study at the moment called Safety Net, or she's a part of this study, which is looking at academic and professional partnerships to create a culture of safety for spinal manipulation therapy in children. And so she's running a study at the moment to look at how safe chiropractic adjustments are, and I'm sure it's going to bear out to be safe. I think we know that as practitioners, but we need the research to be able to back that up. So I applaud Katie for doing that on pediatric safety.
Well, and I do too. I just want to go back to her. I was always involved with the pediatric community and always had a family-oriented practice. We know from clinical experience how amazing chiropractic results are in the pediatric environment. What you're saying is she's actually documenting it in a research method to document what we've already experienced in the clinical environment. And I think that's really important. But we do have that experience and no outcomes, just not as much documentation as could be, I guess.
That's correct, and that's part of evidence-based practice, looking at the doctor's experience over the years, looking at patient values. I mean, some patients don't want to take medicine, right? They want to get adjusted. So they want what we have. We have the experience, but what we don't currently have is a lot of empirical evidence through research that demonstrates the safety and the effectiveness. And I can tell you that there are several large-scale studies that are going on right now, and the next couple of years are just going to be amazing. Just so pumped up about what's coming out in the pediatric realm. But so another podcast was what I took away from it from Bernadette Murphy, who's in Ontario. She's a chiropractor PhD in neurophysiology. She talked about strain in the brain during the podcast, and this got me thinking. Most of the time we think of strain as, the physical aches and pains and muscular injuries or things that our patients come in complaining about. But what she made clear to me was that, yeah, you get these things that are out in the periphery, but where it really has an impact, these types of injuries, are in the brain. And the way the brain processes information changes when you have joint dysfunction. And in her words, she basically was saying that chiropractic can reverse that. And so her work in conjunction with Heidi Havik, and I know you've had Dr. Havik on the show before, and I've interviewed her as well. And so both of them are doing some fantastic work in that. One of the takeaway points that I got from her talk was, to make these changes neurologically in the brain, it takes time. And she used a term, I don't know if it's a common term, but she said replasticize. So in other words, they've undergone plastic changes after injury, so we need to replasticize it. When we give our adjustments, these adjustments are not going to replasticize overnight. So it takes time. So we have to realize, you're probably not going to be a hero after one adjustment, but if you are, that's fantastic. But it's probably going to take some time to change the way the brain is functioning. Another talk was with Dr. Serbal, and he's a chiropractor PhD in Ontario as well, and his interest is in myofascial pain. And so what he's looked at is that, for example, trigger points in the trapezius or infraspinatus or something may actually be a result of something that's going on at the spine level, spinal cord level, and that what he feels is that the adjustment and other modalities that chiropractors use can actually get more to the core of these myofascial trigger points and myofascial pain, and that they have an influence on central sensitization. So it takes it not just from what we're doing to the periphery, but also to the nervous system, and ultimately to the brain, and hopefully to mitigate the impact of chronic pain. So that was an interesting talk. And then, of course, Heidi Havik. So she's doing some groundbreaking work in New Zealand, and one of her main points that I got from her podcast was that she feels that subluxations are thought to be central segmental motor control problems. So at a local level in the spine, for example, those local spinal issues can translate to brain issues. And so I titled the podcast Brain Adjustments because her research is starting to show that adjustments have an impact on the central nervous system, specifically brain. And some other things that I got of it for the practice were, geez, if it's affecting brain, if it's affecting multiple parts of our central nervous system and even our periphery, then we should probably be assessing for various things in our practice, such as strength, fatigue, visual perception, joint position sense, because these sorts of things are being shown now in chiropractic to have an impact on the patient. So better strength in several papers, reduction in fatigue, better perception, etc.
I want to point out that yeah, you had mentioned, and it's true, we know Heidi Havoc and her work very, very well. We have sponsored a lot of her work as well. If you have the opportunity to hear her speak, take it, whether it be on a podcast or live, because this woman is doing really groundbreaking work in terms of chiropractic research that's going to benefit all of us. So thanks for bringing that to the table as well.
Yeah, thank you, Dr. Hoffman. Another thing I'll mention is that she has a great model. She's actually trying to answer the questions that I think a lot of chiropractors in practice have. She is not getting funded, to my knowledge, through agencies like NIH or things like that, but those kind of organizations don't really fund the kind of research that I think a lot of chiropractors may be interested in. Certainly back pain and neck pain are things that we deal with, but I got into research because I was interested in human performance, and that's not really generally something that large granting organizations are interested in. But if we have time, I'll tell you about a study that I'm involved in looking at the DoD and the military, and we actually have just finished recruiting for that study, and so we're looking at actually some human performance measures, so it's pretty interesting. But let's talk about Scott Haldeman's talk here, his podcast. Of course, he's a huge name in chiropractic, and I took away some really interesting points from his talk, and that was, he said there's, the spine is the most exciting and interesting organ of the body. I totally agree. He says there's no such thing as a spine nerve doctor, a spine muscle doctor, a spine joint doctor, or a spine disc doctor, because you have to know the entirety of the spine to get the best results. And I took away some practice points, which are, okay, we can combine pain relief, i.e. with adjustments, but we also need to, based upon the latest research, start working on behavioral changes. So if people are smokers, we know that that's a risk factor for back issues, spinal issues. Reduce drinking, exercise more. Of course, these things are things we hear all the time, but they make such a big difference. We also need to probably start addressing, if we're not, psychosocial issues. So reassure people, okay, look, Mrs. Jones, you don't have a cancer or a tumor or anything that serious, but you do have some spinal issues that we need to deal with, etc. We can educate our people and hopefully get them to the right place in terms of solving any legal issues they may have, because getting an attorney is one of the most powerful ways that has been shown to delay healing, interestingly enough. Chiropractic is effective for low back pain, so I think we all knew that, but there's a really neat paper that came out by Dr. Michael Schneider, a chiropractor PhD. I believe he's at University of Pittsburgh. And what he was looking at was a randomized controlled trial comparing spinal manipulation to usual medical care for acute and subacute low back pain. And what he found, and this paper was published in 2015, was that chiropractic manual manipulation provided greater reductions in reported disability and pain compared to usual medical care. How about some biomechanical changes?
There's a lot of people that watch our show that I would say, you know, there's a sensitivity about some of the research when they hear it's about back pain rather than the vertebral subluxation and overall performance, as you know indicated earlier. And you know, there's so many ways to utilize this, no matter how you practice or how we want to educate patients, because even if we want to do a lay lecture and educate patients on the far-reaching effects of the vertebral subluxation, reconnecting man the physical to man the spiritual, or anything else, when we have a study on low back pain, whether we like it or not, patients do relate to that. And when 80 some odd percent of the population actually suffers from low back pain, that's a starting point and a commonality that the patient will be attracted to. And I sure as heck want them to come into the chiropractor, even if their first inclination is my low back hurts, they can help. Educate them further once they come in, but I'd rather see them come in to a place that works on their behalf, which is the chiropractic office, than going to a medical facility and having more traditional care, which is simply painkillers and muscle relaxers or surgery. So no matter what your philosophical tenets are, these are so important and can be used in such positive ways to educate, address your patient's needs, as well as to attract patients into your office to educate them more thoroughly.
Yeah, I couldn't agree more. I mean, we know that most people come in to see a chiropractor because they have pain, and so this is a really important study, in my opinion. And you're right. I mean, getting back to the human performance and neurological changes, all studies take a certain amount of money to make them go, to pay investigators, etc. And again, if chiropractors want the more traditional kinds of things, you know, looking at visceral functions, etc., then we're going to need to support that kind of research. And I think chiropractors are going to have to dip into their pockets, Dr. Hoffman, and actually come up with this, because I don't see some of the large granting agencies being, I don't think, frankly, they care about that. So they're more interested in pain and things like that. So hopefully we'll get to more of those kind of studies that I think a lot of chiropractors want to see. But these studies on back pain, neck pain, biomechanics are vitally important as well. So you're right, we need all of it. And I'm just trying to share what's out there, because there's a lot of cool stuff out there. So another paper is on biomechanical changes with manipulation. Greg Kotchuk is an amazing investigator up in Canada, and what he's found, his group has found, is that there are 3 biomechanical measures they've found at this point that relate to how manipulation seems to reduce pain and improve disability and improve function. And those are spinal stiffness, so basically taking a rod, as you see on the PowerPoint slide here, and kind of poking it into the spine, seeing how loose it is. And after adjustments, the spine goes from one that's kind of stiffer when you poke it to more loose, more degrees of freedom, more movement, I guess you could say. Less pain also that comes along with this. And then we get an improved activation, so better motor control from my perspective in terms of some of the surrounding musculature of the spine, the multifidus, for example. And a concept that I'm not quite as familiar with, but this is disc diffusion. Apparently, what they found is that through MRI kind of studies, they found that diffusion into the disc seems to improve after chiropractic care as well. So practice points, nothing specific here, but I think we're starting to show functionally why patients are actually responding to care. And I think at some point we'll have tools that we can translate into practice. Dr. Hesbeck from Denmark was a really interesting podcast interview. She's doing some amazing work. I mentioned before about some of the really large pediatric studies that are going on, and she is the main investigator on those studies. They should be out, I'm hoping, within the next year or two. They're wrapping up the studies of that. So look out for those. In one of the studies, she has over 300 children, so it's going to be absolutely enormous and impactful when these start coming out. What we talked about in the podcast with her was the typical course of back pain, and we specifically looked at kids and adolescents. And children have back pain, and I see it all the time in my practice. I'm seeing younger and younger kids with pain as their presentation chief complaint, and whether it's headaches or neck pain or back pain, they're coming in. They're coming in a lot more regularly than when I was first in practice about 19 years ago. So, practice points I took away from this talk was that kids are in more pain. There is no real cookbook approach to treating individuals, and that we need to focus more on prevention. And of course, we need to manage the pain when it's there. But people have pain. It's something that I think chiropractors, our stuff, our chiropractic adjustments and our other care that we provide works really well. And I think sometimes chiropractors get really upset when the pain's not gone in a couple of visits. But we have to realize that pain is a part of life, and people have pain. And so it takes a cycle. It goes through typical time course, and so that podcast talked about that. And then this is the last podcast I wanted to share with you, and this was Dr. Kent Stuber, and he was talking about patient-centered chiropractic care. So if you remembered from the beginning of the talk, we talk about evidence as one part of evidence-based care, but then patient values and experiences are another part, and then the doctor's experience is another part as well. So Dr. Stuber is now the current editor of the Journal of the Canadian Chiropractic Association, published many studies, very good studies, and so he was looking at patient-centered chiropractic care, and there's very little on this, so his PhD is going to be about that. And what I took away from that is that we need to work with patients on what they are interested in. So we need to perhaps ask more questions. Is there stuff that they can do at home? What's the frequency of care? I practice in a pretty rural area here in Ohio, and so we get a lot of farmers that come in, and so it's tough sometimes when they're in season, getting them in 3-4 times a week. It's just it's very difficult. So you have to work with people as to what they can do. And so that's the end of my presentation. I just wanted to point out that chirocredit.com is a company that provides continuing education. They have helped me to get these podcasts going. We're available on iTunes. We're on LinkedIn, Facebook, Twitter. You can find us if you just Google us. We'll be there. If you're interested in contributing at all financially to our mission, there's a page on our website, chiropracticscience.com, that you can do that as well. So,
and we'll make that information available as well, Dean. But I want to just talk a little bit with you, and thank you. That was really helpful to share with people, and they can always get a fuller version by participating, whether it be on Facebook, the podcasts, or on the website. But let's just talk a little bit about how the doctors would actually utilize this type of information in their practice to educate their patients and things of that nature. What would you want them to know?
Well, I've jotted down about 10 points here, so whatever time we have. But I would start right from your encounters with patients at the mall or wherever you meet them. So that's a good place. If you're doing talks out in the community, try to incorporate some of the evidence. Have slides maybe that have quotes from research articles. I think that's a really good way to do things. I can give you some examples of my own practice. For example, in our waiting room, I have a PowerPoint presentation with about 200 slides on it that talk everything from pediatric chiropractic care, what evidence exists for that, to human performance effects, and so on and so forth. And so I just use very short snippets from the articles themselves and give a little picture that goes along with it. So it looks nice, and I can't tell you how many times patients say, hey, I didn't know that chiropractic could improve my strength, or whatever the case may be. something, something is always of interest, and so people relay that. So I
I
think that's a good
agree.
way.
And I'm glad that you said little snippets, because my take on it and what we teach the doctors even to do when it comes to the stroke research, that we offer, the information up to them, whether it be the Cassidy study or Kozlov talking about that there's no additional onset of these vertebral artery dissections following a visit to a chiropractor versus a medical doctor, or the casual relationship between chiropractic adjustment and cervical artery dissection, which hasn't been established, which was Church and a couple of other people. There's so much of this research that we educate them on, and we don't want them to go and just blurt it out because it sounds kind of defensive.
Right.
You don't go to the medical doctor and hear all of the research, but what you do see, and this is something almost offensive to me, when I wake up in the morning and I'm getting dressed, I always have on the local news, and they always have what they call their health segment, which never has anything about health. And it certainly, therefore, never has anything about chiropractic. And when they're offering up, they're just mentioning, hey, there may be help or hope for people with XYZ, and they give a little blurb, more research to come. And
Right.
I think that that's a really good way of doing things, because that's what patients in a chiropractic office are experiencing everywhere around them, is that people are sharing information. We're in an information world. And getting that out to them, I think, is a really good thing. The waiting room, I'm so glad that you said that. I can even see, and maybe I'm, beating you to the punch, but, in certain email or email newsletters, just mentioning a little bit about the research, or, your own social media, right? On
Absolutely.
Facebook or whatever. But one of the things that I can think of that I think would be awesome for the doctors after listening to you is create their own podcast based
Absolutely.
on the research that they can get right from participating with someone like you. And I think that that would be great, in addition to, adding it into your lay lectures or inviting people in for a specific topic
Yeah.
and include it. So I don't know if I cut into your ideas, but I just wanted to put some of that out there.
No, that's perfect. I have many others, so yeah. So again, my process is kind of right from the beginning when patients walk in the door all the way through the entire visit. So you got my ideas about Facebook, and you can certainly share our posts from Chiropractic Science and share them on your page. That's what we have them there for. So feel free to do that. You can go to chiropracticscience.com, link to any of the stuff there. How about at spinal screenings out in the public? So one of the things that Chiropractic Science has shown is that people improve their reaction times. Grip strength is improved. Heart rate variability is improved. So there's lots of things that the chiropractor may not know about, but for example, at spinal screenings, there is a simple way to check for reaction time where you use a hockey puck on a long stick, and you just let the hockey puck drop, and you grab the stick, and it goes a certain distance, and then from that you can determine the reaction time. It's just simple things, but it gets the conversation going, and then if people are interested in research, they'll ask you about it, and then you can talk about it. So in lay lectures, again, I would use something similar to what I have in the waiting room. Talk about some slides that have some snippets on them about whatever you're talking about. If you're a sports doctor, talk about some sports studies and put quotes of that in there. Now, this also gets into my office intake forms as well, Dr. Hoffman. So, for example, before ChiroSecure had the stroke informed consent form out, I would take a study that just came out and use language from that study and actually insert it into my intake forms as part of the informed consent. So when Cassidy's study came out, I got so excited, and I was able to implement that the same day that the study came out. It was already on my intake form ready to go the next day. So I think one of the things chiropractors can do is be early adopters of information, get the information, and then start using it. I think that's really the key thing. Other things that you can incorporate into your intake forms would be information about red flags. So we know recently in the not just chiropractic literature, but spinal literature in this case, that red flags of, for example, cancer or ominous kind of signs and symptoms, those kind of things you can actually ask for in your intake forms. During the history exam and assessment, in terms of what kind of clinical tests, you can listen to Dr. Hesbeck's podcast. She gives some good pointers about what the evidence is for clinical testing. We know that there's a lot of good stuff for outcome assessment forms. I intend to have a podcast about that. There is good evidence when it comes to actually adjusting people now that we know the evidence is best for provoking pain in someone with a history of pain or a chief complaint is pain, to try to find out which segment to adjust. So there's actually some good research there, and there's good evidence to support the static and motion palpation there. How about during your table talk? So as you're adjusting people as well, you could pick a study of the day to talk to your patients about. Whatever interests you that day. If you want to talk about headaches, or you can just go patient by patient. If someone is complaining about headaches, you could say, hey, Mrs. Jones, I don't know if you knew this, but there was a nice study done last year that showed a reduction of headaches, etc. So you can do whatever you like that way, but table talk is another good way. I like doing summaries for other providers. So if you have a mutual patient or you get referred a patient from a medical doctor or PT or something, one thing that I do is I do my little summary, my little case note, narrative review for the other doctor, and then put a little quote or two from the science literature, the chiropractic science literature, to support the things that I've done with that patient. You can do the same thing for PI cases or workers' compensation or things like that. I always like to try to incorporate a little bit of science, and it may be overkill in some cases, but that's okay. I'd rather be overkill than not have anything there, in my opinion. But then again, I'm a researcher, so that's what I do.
Yeah, and we appreciate it. I want to just, as we're coming to a close, I just want to share a couple of things. You mentioned table talk. I think it is so important that the doctors hear you with that, because, just yesterday I had a doctor call me up, and he needed some advice, which is what we do all day long. And when I was speaking to him, it turns out that this patient had come into him for 2 months, and the patient had some upper back and lower neck issues, and that's what provoked them to show up in the office in the first place. The patient had already gotten a progress examination. Everything was showing improvement all the way around. But the patient had also gone to their orthopedist. The orthopedist, what they do is surgery. So it was an orthopedic surgeon. He sent the patient for an MRI. The patient went back to the orthopedist. The orthopedist did recommend surgery and said that if you move your neck the wrong way, the wrong time, it could be curtains. And you should never let a chiropractor adjust a neck like this with a disc like this on the MRI. And I said to the doctor, if you had talked to the patient as you were taking care of them, they would have already known better. But let me tell you this. When you're going to, because the patient came back with the MRI and said, what are you going to do for me? Meaning,
Yeah.
He wanted his money back for 2 months of care. And
Yeah.
I said, hell no. I said, he should go for a second opinion, because he went to someone that sells surgery who's now selling it to him with fear. When the second opinion comes back, if it's any different, I want to know, are you going to ask that orthopedist for your money back? Just because you got a different opinion.
Right.
You now have a different opinion from what we recommended and what we actually did that worked. So why would you go to the doctor that's selling you surgery to buy surgery when you've already done well with the care you've had here and you want your money back here? Makes no sense. And it just goes to prove your point, Dean, that table talk is so important, because if he would have educated that patient a little bit more thorough along the way, he would have been prepared when he went to the medical doctor with the right questions. Well, if it's that bad and it's that dangerous, how come I'm doing better with that? And why would I go under a knife that is so risky and you can't take back? These are things that can all be resolved through proper education and by offering up some information as you've presented today. And I just want you to know we appreciate all that you do. And I'm so thankful that you participated in our show, because, you know, this research is important to all of us. And so, you know, at ChiroSecure, we're dedicating ourselves to make sure that if a patient alleges that a chiropractic adjustment causes an arterial dissection, the most aggressive defense available based on research will be asserted. And that's a different research. It's just one that is more direct relationship to what we do with our doctors. But this is a huge commitment on both ChiroSecure's part from a financial point of view, but also a time standpoint, as you know, with all the research that you've reviewed. And from this point forward, when doctors become part of the ChiroSecure family, you are supporting a cause that actually promotes the most aggressive defense available based on the best scientific evidence. So together, you, me, and ChiroSecure will make a change in the public perception, in addition to what Dean has shared with you today. Take it and use it, because we need that change to be about chiropractic for now and forever. I just want to make sure that you know that if you download the ChiroSecure app, you'll get excerpts from Dr. Dean on the different research each and every month. So stay updated, download our app, and it'll keep you up to date on all the things we do, but also Dr. Dean's content as well. So thank you, Alan.
Okay, thank you, Dr. Stu, and thank you, Dr. Dean Smith. Tremendous presentation. Great to see that so much research is going on in the chiropractic world. Let it be known that a good portion of the research that's going on in the chiropractic world is sponsored by Dr. Stu Hoffman and ChiroSecure. On the right of the page you're looking at now, you're going to see the ebook cover with Dr. Dean Smith's picture on it. Right above that, if you enter your name and your email and the contact information, we will send you a transcript of today's show, the complete transcript, as well as a copy of Dr. Dean's PowerPoint slides. Now, right above that, also on the right side of the screen that you're on, you'll see the ability to click on the link. It's an image to enroll in the ChiroSecure concierge service. Now, thousands and thousands of doctors have already signed up for the concierge service. And what it does is, once you sign up, it'll automatically notify you of every event. But better than that, what it will do is it will automatically send you the notes, the transcripts, and the links to the replay, even if you don't get an opportunity to sign up for one of our exciting shows that are coming up. So it puts you on the automatic fast track to make sure that you're on top of all the live events we're doing. When you get to the concierge page to sign up, you're going to see a box like you see on your screen, and there are 3 choices. If you're not already a ChiroSecure client, I want you to check the box, the 3rd box down. Well, not only will this sign you up for the concierge service, but it'll also give you the ability for us to quote you to find out how you could save from 10 to 40% on the current premium that you're paying already. When you go to close the browser and leave our website, you're going to see a very short exit survey pop up. We'd very much appreciate if you would complete that short survey. One, it tells us what you want us to do, the guests that you would like on the show, the topics you'd like to know more about, so we at ChiroSecure can bring as much value as possible to you and your practice through these live events. So make sure, it's literally maybe 3 questions the most. Please fill those out so we know to bring to you exactly what you want. Last thing I want to remind you is make sure you go to the App Store and Google Play and download the ChiroSecure Malpractice Insurance apps. We have some of the best leaders in the profession contributing to those apps every single month about practice management, marketing, HIPAA, coding, you name it. And in addition to that, of course, you always get our live events automatically, as well as our risk management tips and any information that you need to keep you in the know while you're on the go. On behalf of myself, Dr. Alan Moinstein, Dr. Stu Hoffman and ChiroSecure, we want to thank you for stopping by. Make sure you go to the App Store and Google Play, download the ChiroSecure Malpractice Insurance app. We'll look forward to seeing you again next month.